This is a follow-on from what we had previously discussed with perampanel's effectiveness for generalized seizures. And in this 307 study, what they had found was that the seizure freedom rate in those patients who were on perampanel for adjunctive therapy was very robust. But one of the criticisms would be, well, it's only a 12-week maintenance phase. How do we know that it continues to work afterwards? And what was done in this post hoc analysis of these patients in the open label extension part of the study was to say, well, of those patients who were seizure-free during this 12-week maintenance period, when they entered the open label extension, how many of them stayed seizure-free? And what was gratifying was the fact that I think around 90% of them, even 6 months after entry into the open label extension, maintained their seizure freedom. And then the numbers dropped a little bit afterwards. But often the reason the numbers dropped as you went to 1 year, 2 years, and 3 years out was because many of the studies were closed out, so they couldn't continue with the open label extension. But even if you get to 6 months or a year, having a 75% or 90% sustained seizure freedom indicates that that data from the controlled study was sustained afterwards in the open label extension. Yeah, I think it's very difficult to do a longer study. And so what they want to do a study that they believe is clinically meaningful over, say, a 3-month period. And if it is, they're able to, the data is published. And then if you want to look at questions such as sustainability of seizure freedom, that's when you do an open label extension. Well, in the generalized seizure population, even though it's approved both for partial, secondary generalized and primary generalized, that's where the really robust effect is with perampanel. And also because of the fact that you can use it once a day, it also has an added benefit as it relates to compliance.